Assalamu alaikum and good afternoon. I'm Dr. Farooq Rathore, consultant in rehabilitation medicine from Pakistan. I represent Pakistan at a number of international organizations and I'm also involved with Cochrane Rehabilitation. And today I'm going to talk about neurorehabilitation services in the OIC countries. Before I formally start my presentation, I feel it is important to know what neurorehabilitation is all about. Because in public and even in healthcare professionals, there are a lot of confusion that what is neurorehabilitation. For many, it only means some form of physiotherapy or advanced exercises. But this concept is not holistic and incorrect. Neurorehabilitation is defined as a dynamic process which helps patients with neurological disabilities to optimize their physical, cognitive, emotional, and social functions for maximum independence and social integration. This process must involve a rehabilitation medicine physician or what we call a physiatrist as a team leader. As you can see that neurorehabilitation is not a static process. It's a two-way dynamic process which involves not only the rehabilitation team but also the patient and the family and the caregivers. In addition, this is not something that sometimes can cure the patient, but we know that many of the neurological disabilities are not curative. They cannot be cured by the current medical treatment. And some of the neurological disabilities, specifically the neurodegenerative, are going to progress as the time goes on. So what do we need to do in these kind of patients? We have to maximize their independence and social integration by focusing on their physical, cognitive, emotional, and social potentials and function. And this is what neurorehabilitation is all about. Neurorehabilitation can be offered in a multitude of conditions, ranging from stroke, different kind of brain injuries could be traumatic and non-traumatic, CNS demyelinating disorders like multiple sclerosis or acute demyelinating lesions, spinal cord injury which could be both traumatic and non-traumatic, and by the way, non-traumatic spinal cord injuries in form of spinal infections and transverse myelitis are pretty common in the developing world. Neurodegenerative disorders, pediatric disabilities like cerebral palsy or different form of spinal dysraphism, peripheral nerve injuries and polyneuropathies including GBS, and neuromuscular disorders like myopathies and neuromuscular disorders like myasthenia gravis. This is a classical paradigm that how neurorehabilitation team is built and how do they provide service. So as I just told you, neurorehabilitation is a teamwork. It's not a job of an individual physician who sits in the office and gives prescription. It's a job of a teamwork. Every team member brings in a certain skill set and that skill set is used to assess the disability of the patient and then to optimize their health condition depending on their potential. This neurorehabilitation team classically must include a rehabilitation medicine physician or a qualified physiatrist, then a neurologist, a colleague who helps us, occupational therapist, a physical therapist, prosthetist who makes splints and supports, psychologist who takes care of the mental health of the patient with disability, a speech therapist who would evaluate dysphagia and communication disorder, and at the center of this team is patient. And this is what a neurorehabilitation team looks like. The first comprehensive report on disability was the World Report on Disability by the WHO and the World Bank, which came in 2011. It's an excellent report, and the salient feature of the reports are that disability prevalence is high and growing. They estimated that around 15% of the world population was having some form of disability, and at that time they estimated it to be 1 billion people around the world, and the current estimates are around more than 1.5 billion people around the globe. And disability disproportionately affects the vulnerable population, and one of the vulnerable population is the people who are placed in developing world because of low access to healthcare resources. And in addition, people with disabilities have worse health and socioeconomic outcome. Now if we correlate this with the situation in the OIC countries, so we would note that majority of the OIC countries at present are classified as low income countries or low middle income countries, which means that they are sharing a huge burden of disabilities which is neither documented or does not get services that they require in form of an adequate early multidisciplinary neurorehabilitation. In addition, for most of the OIC countries, because they are developing countries, their healthcare systems are not well developed. In case where healthcare systems are developed, they are more geared toward management of infectious disease and acute medical management. And rehabilitation services and structure are either non-existent at all, or they are not very well developed, or they are not prioritized. As a result, many people with neurological disabilities and illnesses, and I told you the whole list: stroke, multiple sclerosis, ADAM, childhood disabilities, PNS disorder, and all these people, they get neglected, thus adding to a huge global burden of disability. So with this background in mind, I decided to conduct an online survey and a cross-sectional survey on the neurorehabilitation services in the OIC countries. So what I did was that I made a Google form, because free, it's accessible and can be shared with anyone. The main components of the form were the demographic data of the person who responded to my survey, the kind of rehabilitation services available in the country. Specifically, I talked about the neurorehabilitation services, and I broke down into different components, then the type of services, the training available in your rehabilitation and for whom, then the local guidelines on local diseases if available. I also inquired about the membership of World Federation of Neurorehabilitation, and I asked them to give different kind of comments on the neurorehabilitation services in their countries. Identification of resource person was a big challenge for me, because honestly speaking, as I just told you, neurorehabilitation services are not that well developed, and we are not well connected, at least in the OIC region. So what I did was I went online on ISPRM, which is International Society of Physical and Rehabilitation Medicine, and I tried to get the email and contact address of key resource person for rehabilitation in that country. I also explored the website of World Federation of Neurorehabilitation, National Society's web pages, and then snowballing technique, because I have a large group of people working in different parts of the world. I collaborate with them, and I asked them and requested them to identify the right person from different countries, OIC countries, whom I could approach and ask to fill in this questionnaire. So this questionnaire was distributed in the first week of January, and then I sent another reminder in the third week of January. So this is a bit unfortunate, but despite my best effort and snowballing and asking my colleagues, out of the current 57 countries which are members of OIC, I was able to locate the valid contact and emails of only 20 countries. So it actually represents less than 50% of the OIC countries. And out of those 20 countries and 20 emails that I generated, my response rate was 60%. So only 12 colleagues from these countries responded to my email survey. It includes Afghanistan, Albania, Bangladesh, Brunei, Benin, Cameroon, Indonesia, Iran, Morocco, Saudi Arabia, Pakistan, and probably Turkey. Yeah, I filled a survey from Pakistan myself. So these are the results. So as you can see that most of the people who responded to the survey were actually in the senior hierarchy. Some of them were professors or attending consultants or head of department, and at least one of them was actually the president of their own local PMR society. Again, I'm only going to share the results without giving any comments, but this was a bit surprising for me, because I know that these kind of services are not freely available in most of the OIC countries. But whatever I saw, I'm going to share with my colleagues. So the first question was, are rehabilitation services available in your country? And almost all of them said yes, in some form these services are available. That was great. Then I asked, are specialized neurorehabilitation services available in your country? And majority said yes. But again, some there are two countries, that one located in Africa and one in Afghanistan, said there are no specific neurorehabilitation services available in their country. So I then inquired what kind of neurorehabilitation services are actually available. And as you can see that most of the countries had a good stroke rehabilitation service system in place, followed by spinal cord injury and pediatric neurorehabilitation, because these three constitute the majority of the disorders in neurorehabilitation group. Then some countries had neurorehabilitation for multiple sclerosis, traumatic brain injury, and neurodegenerative disorders. Some countries also offered neurorehab for neuromuscular disorders. Then I inquired about the training programs, and here it's sort of like divided equally between different countries. So in some countries it was available only for physician. In some countries it was available only for rehabilitation professionals like physical therapists, occupational therapists, and speech and language pathologists. And few of the countries had a training program both for the physician and team members of a neuro rehab team. Unfortunately, in quarter of the countries that I surveyed had no training program, indigenous local training program in neurorehabilitation, either for the physicians or for the rehabilitation professionals. So what is the estimated percentage of population which has access to neurorehabilitation services? And again, as you can see, so very few countries said that around 100% of their population has access to neurorehabilitation services. And these were the countries which are actually located in the higher income zone. For majority of the countries located in Asia and Africa, the access to neurorehabilitation services was less than 25%. And this is a matter of concern actually. Imagine a country having a population of more than 100 million and a huge disability burden, and less than 25% of the population has access to neurorehabilitation services. Then I inquired that is there a professional organization or a society of neurorehabilitation in the country? And the good news was around 70% of the respondents, that around 9 out of 12 said yes, there was a specific neurorehabilitation organization available in the country. 2 said no, and 1 said I don't know. And then this is we have to network with the global world. So one of the networking in neurorehabilitation is to become a member of World Federation of Neurorehabilitation. As you can see that most of these organizations in neurorehabilitation were not the member of World Federation of Neurorehabilitation, and only a quarter, that is only 4 out of 12, were member of World Federation of Neurorehabilitation, which is at present the largest global consortium representing neurorehabilitation professionals based in different countries, including developing countries and OIC countries. Then there's depending on the system, ideally a neurorehabilitation service or a rehabilitation service should be maintained, managed, and delivered in under the supervision of a qualified rehabilitation medicine physician. But sometimes it's not possible. So I asked this question to my colleagues, and most of them, like around half, said yes. Primarily, it is the rehabilitation medicine physician who delivers rehabilitation services in form of a team network. But in many cases, since we know where rehabilitation medicine physicians are not available, our colleagues in physiotherapy and occupational therapy, they are providing services. So around 1.5 quarter of the countries, around 5 out of 12, they said that around the neurorehabilitation services are primarily provided by the physical therapist. So these are the different models of neurorehabilitation services that are being provided in the OIC countries. So as you can see, unfortunately, it is a global reality that most of the expenses for rehabilitation are borne by the patient from their own pockets. And that's why it becomes a huge financial burden for a person who is undergoing disability. And but in some countries, 8 out of these 12, there was a publicly funded or government sponsorship available for neurorehabilitation services. And then most of them had to pay it off pocket by the patient. Private insurance was available to some, and in some cases it was also available through philanthropic support. And probably here comes the concept of that Islamic concept of philanthropy, which we can actually use in order to provide good quality services to patients who are in need of neurorehabilitation services in OIC countries. So these are the different models of neurorehabilitation services. So majority of the countries where neurorehab is available, they provided this service in both in inpatient or indoor and outpatient. Some also provided day service, and some countries, specifically Indonesia and Malaysia, also had community-based neurorehabilitation network available, which is very important, by the way. And again, asking the question which members of a standard neurorehabilitation team are available. So as you can see that physical therapists are available almost in every part of the world, including OIC countries. And then you have rehab medicine physician in around 11 out of 13 countries, and then speech language pathologist, orthotist, prosthetist, and clinical psychologist. Social workers and the vocational counselor was unfortunately available only in one country, and that should be a matter of concern. Because medical management is good, it's great, but you need to reintegrate the person socially back into the society, and for that you need to have a social worker or a vocational counselor. Nowadays we all know that different diseases present differently in different parts of the world. So it's better to have your own local guidelines on different diseases instead of just like following the guidelines issued by a European country or Northern American country or Australian or Australia, because sometimes those guidelines are not contextual and they don't apply in the lower middle income country context in which we are living and working. So I asked the question, are local disease specific neurorehabilitation guidelines available? And around 40% said yes, but again equal number said no. So and some said we don't know. So I honestly, on ground, very few countries have specific neurorehabilitation guidelines which cater for their own population. Teleconsultation is a rapidly emerging thing, and it has gained a lot of scope in the aftermath of COVID-19. So in response to the question that is teleconsultation for neurorehabilitation available in your country, so majority said it is not available. There could be multiple reasons for that. Maybe they are developing countries, the internet network is not that strong, IT is not well developed, but it is something that we need to think on. So this is very interesting and gives you a first-hand perspective of my colleagues working in their own respective countries in the field of neurorehabilitation. So the last question of the questionnaire was, do you have any other comments and insights on neurorehabilitation in the OIC countries? And there were excellent and very diverse kind of guideline insights. So my colleague from Bangladesh said neurorehabilitation in the region is a new concept. SAR countries, that is countries located in Southeast Asia, have good potential to build up physiatrist-led rehabilitation teams. My colleague from Brunei said it would be great to collaborate and learn from different countries about practice of neurorehabilitation. Another colleague from Afghanistan said that most of the neurorehabilitation services were not being provided by indigenous local people. They were being provided by the International Committee of Red Cross and Red Crescent, the Swedish community, and the Handicap or HI International. Again, it is a food for thought for OIC countries that we need to support other OIC countries in establishing healthcare services and particularly neurorehabilitation services. Then my colleague from Cameroon, Africa, a developing country, said that some human resources are available, but there are no global policy regarding neurorehab in their country. And some private associations are also training their rehab healthcare professionals. So colleague from Indonesia informed us that neurorehabilitation society in our country is not well established, but we do have subspecialist neurorehabilitation physician in the country. And as is the case in many countries, insurance does not cover orthotic, walking aids, wheelchair and botulinum toxin for spasticity, at least in Indonesia. Then colleague from Turkey revealed that the patient in the need of neurorehabilitation, they receive both inpatient and outpatient neurorehabilitation services, but within the general rehab department. And in addition, the Turkish Society of PMR, which is by the way very active and doing a lot of work in their own country, they have developed specific neurorehabilitation working groups and guidelines, specific and contextual to Turkey. And colleague from Morocco revealed some really good enlightening things. So they have a module on rehabilitation in undergraduate medical education. They have practice guidelines for home care for stroke and spinal cord injury. And they have recently in 2020 started a one-year university diploma program in adult neurorehabilitation. So I end my talk on a call for action, or what I call a work plan. These kind of presentations and these kind of workshop are excellent because they bring together expertise and people with knowledge from all around the globe. But it would be very important to actually consolidate this knowledge and come up with a genuine action plan, a work plan on which we can work instead of simply going back to our lives. So this is what I propose to my colleagues in OIC and COMSTECH in particular. So probably I started with a very small survey, but I feel there's a need for a large survey to determine the burden of neurological diseases in the OIC region. And probably we can also work toward establishing an OIC neurological disease registry in the long term. Then we need to know the current status of neurorehabilitation services in all of the OIC countries. This was a very small survey which was representative of less than a quarter of these countries. So probably this does not capture the whole picture. Then we need to develop neurorehabilitation services, and we can do that by sharing of knowledge, experience. We can do exchange programs in countries who have well-established neuro rehab programs, and then we can actually do online courses. This is a virtual conference, which means that people don't have to travel, but they can share their knowledge from their own offices and from their homes. Then probably we might want to create country or OIC specific neurorehabilitation guidelines, because OIC countries are Muslim majority countries. We have a different perspective. We have some certain different issues, and maybe we can somehow sort of like create Sharia compliant kind of guidelines which integrate the Islamic principles along with the medical principles. Will be a unique things, but will be doable. In addition, many people, researchers, students, faculty members based in developing countries, and especially OIC countries, are doing a lot of good work. But unfortunately, that work does not get published because of lack of resources. So probably COMSTECH and OIC Secretariat can work on this, developing grants and giving them support for publication in high-ranking international journals so that their voice and their good quality data reaches a global audience. So thank you all for your patient listening. If there are any questions, comments, and additions, feel free to email me at farooqrathore@gmail.com. So thank you again and have a great day. Assalamu alaikum.